I remember just before, the night before the Dáil resumed, Simon Harris sent me an email and he wanted to meet. Right, the night before the Dáil resumed, because he knew there was a child and a family in the gallery the next day in Dáil Éireann. So that'll tell you about the underhandedness of the government. It was a handshaking exercise and it didn't work. I didn't actually go after. I didn't go to the meeting. I was there, will I or won't I? And I just said it was for the government's benefit to say that they met with, an advocacy group or whatever, as if they were trying to do something or as if they were doing something positive. But it was really for their benefit, as it usually is.
Hi everyone, welcome back to Gript Media. I'm your host Maria Mains. Today we are joined by Gary Farrell of Scoliosis Ireland. Gary, thank you so much for agreeing to sit down and chat to us.
No problem at all, Maria.
I'd just like to ask you to start, for those who are watching the interview who've maybe heard the term scoliosis on the radio or on the television and they don't actually know what it is, would you explain a bit about scoliosis?
Yeah, so scoliosis is a sideways curvature of the spine. So we say in my case, I have 3 different curvatures. I was diagnosed with a condition called Sherman's disease. So I have kyphosis, which is forward curvature, scoliosis then, which is side to side, and lordosis, which is a lower curvature. So it's a little bit different, I suppose. I have I'm not saying a more severe case, but a different case with the 3 curvatures than a lot of people. But scoliosis in itself, it can be very, very severe. And that's, we see it an awful lot in media and stuff lately as well.
So would you talk a bit about your own situation with scoliosis? I know a lot of people that speak on this issue, they have children with scoliosis. It's the main crux of the issue is children who cannot get scoliosis treatment. How did you obviously have the organisation Scoliosis Ireland, so would you speak a bit about your journey with your condition and what made you start your advocacy work?
Yes, so I was diagnosed with Sherman's disease when I was 14. But a couple of years after that, there was no support networks or anything in Ireland. So I had to go to the likes of the UK, the US to try and find different support. So basically, with that, I just said, listen, why shouldn't there be something like this here in Ireland? So in 2010, we founded Scoliosis Ireland. And then, it only started off really with me as a member, and then another member came along. And sure, we have a messaging service now for nearly 20,000 people. Do you know what I mean? So that reaches out of Ireland as well. So we have other members, we say, in the UK and the US and all around the world. But it's fantastic to have something like this in Ireland as well. And we've been campaigning for better services since 2010.
And I think in the media, scoliosis has really become a really big talking point since really in the last, maybe you'll know a bit more about this, but 2016, really in the last decade. Have you seen the problems get worse in the last maybe 10 years?
Yeah, absolutely. Yeah. As I said, in 2010, because I suppose I didn't even know that many people with scoliosis at the time. But as you said, in 2016, we met with the Minister for Health at the time, Simon Harris, in 2016 and in 2017. And of course, in 2017, he made that promise to children that no child would wait, and families, of course, that no child would wait longer than 4 months for scoliosis surgery. A promise he made, a promise he broke. And then, of course, if you fast forward on to Stephen Donnelly, who was Minister for Health after Simon Harris, that promise was also echoed by him as well, and that promise was broken as well.
Would you just, on that note, walk us through some of the promises that have been made to people with scoliosis and especially children?
Yeah, well, the main one, of course, was that in 2017 when Simon Harris did make that promise.
But he said that the situation, just to go back, he said it was appalling and he wasn't going to apologize. He wasn't going to defend the situation. He said, yes, it's appalling, but no child in this country is going to wait more than 4 months for treatment. And he did make that promise.
He made that promise live actually on radio at the time, yeah. And since that, as I said, that promise was completely broken. Things are getting far worse. We see, especially lately, all the different problems arise with CHI. But again, it's... People talk about it. It's a management problem. It's a clinical problem. It's a government problem. The government are doing nothing. CHI obviously can't be trusted with everything that came out lately. So it's a very serious problem for families and for children affected by this.
What is your experience with Children's Health Ireland or CHI? Obviously, it's the HSE body under which children get treatment, and there is a lot of controversy around CHI with this issue.
Yeah, CHI, listen, we raised concerns for years about this. We put different things forward, and we put in different requests as well to try and meet with government, to try and meet with, the Taoiseach, to try and meet again with Simon Harris, because parents are coming to us saying, listen, we don't trust CHI. We don't trust the management of CHI. You can fast forward on then. We had a meeting not that long ago with Jennifer Carroll McNeil, who is now Minister for Health. And we put forward these things again, and we wanted, the board of CHI to be disbanded. Some members did actually resign since that. But again, not much has been done, since that meeting. And, I described it on social media and stuff myself. The meeting was very productive, and it was at the time. But you know yourself, it's what goes on after that really counts.
So, Gary, you have a lot of contact with families who have children who need treatment for scoliosis, and they are being faced with really long waiting times.
Yeah, it's horrific at the minute. You know what I mean? What should have been 4 months, as was promised, is going on and on. There's one child waiting there nearly 4 years at the minute. So now there's over 250 children waiting at the minute on the CHI waiting list. And it's horrific because families are affected, parents, they have it really bad. Children as well, because you only get one shot at childhood. And of course then the government, the government has a duty, the same way as we have a duty, to protect our most vulnerable, which obviously would be children as well. And it's just, they're letting it go.
Yeah, and I've seen stories in the media of maybe a child who has a 30-degree curvature, and they've waited so long on a HSE waiting list that the curvature's maybe grown to I think 135 degrees. And it is the case, isn't it, that if you wait so long for this treatment, it's actually just too late, because the bone fuses together? Yeah,
what happens is, as the curvature progresses, it obviously closes in further on your heart, your lungs. And what happens then is the surgery, they become inoperable. And so much can be done. We have some fantastic surgeons here in Ireland. We're due to recruit another surgeon in August as well. But it's very, very unfortunate that for a country as wealthy as Ireland, even though it's not about funding is always welcomed, more surgeons are always welcome, but as I said, it's a management issue and it's a government issue at the minute.
From the perspective of parents, they are, I suppose they're doing their best, they're paying their taxes. You would think that in this country, in a developed country, if a child needs healthcare, that they're going to get that healthcare, but that isn't the case.
It isn't the case at all, but you're dead right. Parents are doing everything right for their children. Absolutely everything. My heart goes out to them, I would know families over the years who unfortunately maybe lost a child or whatever it is, due to waiting. Again, their breathing became so bad, they became inoperable. And it's just horrific when you see that, and we have such a very supportive support group, if that makes sense. But we have such a network of lovely people, and when this news breaks, it's always horrific,
Mm-hmm. And what is I know scoliosis is quite closely linked to mental health as well, in the sense of there's a knock-on impact on your mental health, especially if you're on a waiting list. You've been promised 4 months, it's going into a year, it's going into 2 years. Even from your own perspective or from the perspective of families, what is the toll mentally like?
Yeah, it takes a huge effect. Because you're going out of your mind with worry. And then, if you have scoliosis yourself, when I was growing up and I had Sherman's, I always felt a little bit different. I suppose as I got older, there was no need to feel different. There was, but at the time, sometimes you do. I tried to mask different things, maybe with hoodies or whatever, to hide the forward curvature on holidays and stuff. I remember going over to Spain one year, and I was wrapped up over there, because it took that much of a toll on me. And then there's children coming up now and they're going through similar, and it's very, very hard to watch.
Yeah, it's a hard age as well. It makes it worse.
It does, yeah.
Guy, what is your understanding of what is actually causing the delays and what must be done to remedy that?
Well, definitely CHI is a terrible, terrible problem at the minute. So the management and the board of CHI, it's the whole thing is mismanaged. Government, you see, if parents or whatever put in complaints, we say it to government or into HSE, what happens then is they reach out and put these back to CHI. CHI then give a report back, and the government more or less just take their word for it. Do you know what I mean? What we need to do is we need to sit down, parents, advocates, children, with government, and see exactly what can be done, and listen to parents, listen to children who are at the heart of this, instead of listening to CHI the whole time.
And what specifically, is, I think for a lot of people, it's kind of mysterious what specifically is the issue? Is it? I've heard Sinn Féin talk about this, where they say with this government there's so much bureaucracy, there's so much red tape, there's layers of red tape, whereas maybe in the past you wouldn't have a government that was so bureaucratic that it just seems that there are so many barriers to getting this treatment.
Yeah, well, look, the government were always a problem. You know, I've been challenging them since 2010. You
Yeah.
know, they never really played ball from the very start. They always let on, they listened. You know, I remember just before, the night before the Dáil resumed, Simon Harris sent me an email and he wanted to meet, right? The night before the Dáil resumed, because he knew there was a child and a family in the gallery the next day in Dáil Éireann. So that'll tell you about the underhandedness of the government. It was a handshaking exercise and it didn't work. I didn't actually go after. I didn't go to the meeting. I was there, will I or won't I? And I just said it was for the government's benefit to say that they met with, an advocacy group or whatever, as if they were trying to do something or as if they were doing something positive. But it was really for their benefit, as it usually is. But as I said, we've been campaigning for a long time. Things are getting worse. The government never really played ball with us. So yeah, it's a severe problem, but definitely CHI, they're at the head and tail of this. Government are there in between as well, because they always take CHI's word for things, but they should listen to parents.
Simon Harris has been asked about this by Gript and others, and I think one of the points he makes, he says, like, we've had weekly reports, there has been progress since 2017, and also that he kind of would say the point about COVID. Do you accept that, like in terms of COVID maybe had a knock-on impact, or no?
No, listen, I've had dealings with Simon in the past. Do you know what I mean? COVID, he's been using this excuse for a long time, for a lot of things, not just this. Of course, COVID had an effect on everything. There's no two ways about that. Of course it did, and we all understand that. But COVID is, it's still around, but it's long gone from those days. And still nothing is being done.
And still that's being used, is it?
Yeah, he's still using it as things like that. Again, I've had plenty of run-in with Simon Harris. Do you know what I mean? But I wouldn't trust one word that comes out of that man's mouth.
You met recently with the new Minister for Health, so Jennifer Carroll McNeill. Do you have more faith in her as Health Minister?
You know, at the time when we had the meeting, as I said, I described it as productive. It was productive because we got across points from parents and stuff. We went up with notes. We got them all across. Do I have more faith? Again, you're still dealing with government. And I know you have to go to these meetings to see if everything's okay. But the only people really that are doing anything about it, or really shouting about it, like you said earlier, are the opposition, are the Sinn Féins and are the people before profits and Labours. They're really attacking government. So I think what government need to do is they need to listen to what the opposition is saying. Those parties, take it in and just meet with the parents again. But as I said, yeah, the meeting itself went well, but it's what comes after that,
In terms of the different causes of this, I've heard people raise before this idea that, like, there has been money allocated for scoliosis and for surgeries, and it's maybe just it's not gone towards that.
Yeah, well, we look back even last year when there was an investigation in about Stephen Donnelly and the funding that was sent across as well to look after this. He didn't even know where that funding went, and that's why there was the investigation. I'm still not convinced that every penny of that went where it was supposed to go. But the problem really, funding is always welcomed, surgeons always welcomed, but the problem here is between management and government, and we need to get that right, and we need to get that right fairly quick, because I don't know how long parents are going to wait. I don't know how much longer. It's ridiculous. It should have been sorted years ago. It actually should never have happened. So it's a real big problem here in Ireland at the minute.
Touching on that, I remember I contacted you back a bit whenever the scandal broke about Children's Health Ireland and the report about non-medical grade springs being used in spinal surgeries on children who had obviously travelled to get surgery because they couldn't get it here. It was a foreign surgeon. Would you explain what happened there for people who've maybe not heard about it, your own insights into that situation?
On the spring scandal?
Yeah.
Yeah, well, listen, that was horrific. Putting a non-medical grade spring into a child's body, knowingly doing that, is absolutely horrific. One child had to come back 33 times after the initial surgery
And to have them removed.
Exactly, yeah. Well, it was one operation after another and one consultation after another, but 33 times. And that's absolutely horrific. I think that the surgeon himself should face the highest of penalties for that. You know, we're talking about a child's life here, and again, another failure.
Do you think there'll be accountability? Because there were resignations, or are resignations.
Yeah, I hope there will be, there should be. And then you talk about accountability, like there is up to now zero accountability. As I said, there has been a couple of resignations, all right, but the government seem to carry on with what they're doing, as if there's nothing wrong. They let on, of course, that they're agreeing with the public, but they still never do anything positive about it because children are still waiting. So there's zero accountability. And as I said, management, government, you know, clinical failures as well. It can't go on.
Do you think the government, our politicians, seeing people like yourself, the parents that you're in contact with, all their campaign groups outside Leinster House, you know, these kids, I was reading recently about a child who was like maybe 4 or 5 years old at the time when she was diagnosed and they knew she needed treatment, and she's outside the door like at 9 years old, like 5 years later campaigning. Like, do you think it has an impact on them when they see the human cost of like these kids waiting for treatment?
I think some of the politicians just don't care, to be honest with you. I think they just don't care. I think it's a fantastic thing when you see everyone coming together. Of course, there should be none of that. We should be entitled to this in Ireland. We should be entitled to proper healthcare for our children. But it is fantastic, like when a group comes together and, you know, to show the government that they won't back down, that they won't accept this, but it's what the government does then after that. And I think sometimes the government, you know, the likes of whether it be Taoiseach, Taoiseach, ministers, sometimes you just walk by these groups. And again, you have all the opposition getting pictures and all taken, rallying around behind them. But the people at the top just seem not to care.
Because like there seems to be good publicity around scoliosis, good PR. But yet, like you're saying, like you haven't, like these waiting lists are still bad. How many children are on? Do you have numbers for the amount of children on the
Yeah,
list?
there's just over 250 children there now at the minute. I mean, that's chronic. That's absolutely terrible. And then, you know, consultations. There's so many waiting on consultations.
Few thousand, is it?
There is, yeah.
Waiting on a first consultation?
On a consultation, yeah.
To begin with, yeah.
It shouldn't happen in a country, as I said, as wealthy as ours. We can look after, you know, we built, I don't need to say it, we built the bike shed, we built the security hut. Do you know what I mean? We had money for that. Do you know? And again, it's not all about money, but we could have put that extra funding into treating children with scoliosis.
What happens when the child misses the deadline? So say there's such a curvature of the spine that it's too late. What becomes of the kids once, and I know a lot of them have other underlying conditions sometimes, is it just a matter of, well, you haven't got the surgery, it's maybe just, you know, you're going to be in chronic pain?
Yeah, that's it.
Yeah.
That's it. If you don't get the surgery, that's it. But all these things could be avoided. All these cases could be avoided at an early stage. And the government, you know, they should be stepping in, and there should be the highest of penalties, whether it be government or whether it be CHI. Do you know what I mean? Because it's criminal what they're doing, letting children wait and letting children suffer. But as you say, if a curvature keeps progressing and nothing else can be done, you know, to the point that surgery isn't an option anymore, the child just lives in chronic pain. It's not right. We're talking about children here, so just terrible.
How much then can surgery improve the situation with scoliosis?
Oh, surgery is fantastic. Do you know what I mean? When, as I said, you know, anything can go wrong in any surgery, but surgery is fantastic because if you have such a curvature that it is closing down on your lungs or your heart or whatever it may be, and you can imagine if your spine is twisted or it's curved down like that, you have surgery, so it comes back like that, comes back in line, takes all the pressure off the heart and the lungs. Again, anything can go wrong on any surgery, but it is fantastic when everything goes right.
Yeah, because you do hear stories in the media of, young people maybe in their 20s and they didn't get this surgery, and so they have, they're actually struggling to breathe. Yeah. Because it's pressing down on their organs.
Yeah, absolutely. And I find that as well, you know, even with my own kyphosis which is the forward curvature, we'll call it a hot day, clammy day, whatever. When it's harder to breathe in general, sometimes there is a bit extra pressure comes down on me. I suppose I'm lucky in a way. Some of mine is structural, so I can actually correct mine to a degree. Some of it's postural as well, do you know what I mean? So I suppose I'm lucky in a way, but yeah, absolutely. It's horrific But when it goes right, when surgery goes right, it's absolutely fantastic.
It's been reported in recent weeks that some people who were on some families who were offered surgery abroad, they actually declined the surgery abroad. And I'm aware of maybe a few things, for example, like the cost, they weren't going to be reimbursed for the cost of bringing the kids overseas. Why, would you explain why some people have declined treatment abroad?
Yeah, well, especially there is a couple of things recently, especially, but if we go back, we say last year, and we had this thing when the government wanted to send a child across with a parent in, say, whatever class it be on a plane, and then put their other parent onto a different part of the plane. That was madness alone. But the other thing is, some cases are actually too complex. So we say if a child's curvature is really, really bad, we can't put them on a plane and expect them to be comfortable the whole way over. That's another problem. And then lately in the media, without like mentioning names, there is one case of a girl who actually travelled over to America. Surgery went okay until after, and then a couple of things happened. So it didn't really go according to plan. So obviously, I suppose when parents heard the likes of that, they are a bit nervous as well. But yeah, there is a couple of things there. And then, you have to get your family and you have to move them basically to another country. Do you know what I mean? So it's a big, big step, of course, to do anything, obviously, for their kids. But when you come back then, your checkups and all are still done over here. So if you still have to go back up to CHI, like how many parents actually trust CHI? And parents are caught big time because their child needs surgery, but do they feel comfortable about leaving their child in the hands of CHI after all the scandals? So they're really, really caught,
The other thing is that's difficult is, like, I imagine it's difficult as parents. Obviously, you're so protective of your child and they're having to go public with their stories. And I assume that they'd rather not, but they think this is my only choice.
Absolutely, yeah. And we see it there the whole time, no parent wants to put their, we might as well say, their children's medical history and their different things out on the papers. That's absolutely horrific. So we put forward different cases, up to the likes of the Dáil, or for questions, for leaders' questions, to see will that help first without really mentioning any names, so they're just down as a case. But to put your child, and especially we see it an awful lot lately, to put your child in the cover of a newspaper and put in their medical history, put in their address, put in their name, that's horrific. That shouldn't go on in any country.
I think you've outlined there what the issues are. Do you believe that they can be solved?
Oh, they can. Absolutely, they can be solved. And it wouldn't even take that much to solve it with a proper management team. Of course, as I said, if we do get more funding, it's not really an issue. Management team, proper government that's actually going to look after this. It can be solved, and it can be solved fairly quickly. We welcome more surgeons, like I was saying earlier. We hope to have one in August. Of course, we welcome that. But it's a thing that can be solved, and it shouldn't be going on this long, and it should have been solved long before now.
Gary, to finish, what is your message to politicians?
Politicians need to get the finger out. Do you know what I mean? The Taoiseach needs to meet with the families. Simon Harris still needs to meet with the families as well. Stephen Donnelly, of course, he's gone. But politicians need to get this under control. CHI, they're an absolute disaster at the minute. So we're calling on politicians to intervene in whatever way they can and try and help these children.
Gary, thank you so much for taking the time to speak with us today.
Thanks, Maria.